Cuba has sent its 16th Medical Brigade to combat the coronavirus to Angola, made up of 214 health professionals. Examples of international solidarity abound in the midst of the coronavirus pandemic. China and Russia are working together to build a hospital to treat COVID-19 patients. African leaders have rallied behind the World Health Organization and its Director General Tedros Adhanom Ghebreyesus following an attack on the agency by US President Donald Trump. From the headquarters of Telesur English in Havana, Cuba, this is From the South. I'm Katrina Goss. A Cuban medical brigade set off for Angola today to support the fight against the novel coronavirus. Our correspondent in Cuba, Nayara Tardo, brings us more details.
Cuba continues to offer its solidarity throughout the world in the midst of the COVID-19 pandemic. This afternoon, a group of 214 health specialists left for Angola to support the country in the fight against the virus. The action by the Caribbean island strengthened the historic ties of friendship between the two nations. More than 14 countries around the world now have the support of Cuban medical brigades that forms part of the Henry Reeve contingent. Meanwhile, on the island, health authorities today reported 58 new cases of COVID-19 for a total of 515 people infected by the virus in Cuba. Cuban government has reinforced the social isolation measures to protect the population and curb the spread of the virus, especially in areas that have reported the largest number of cases. This afternoon, Cuban authorities will announce new measures having entered the limited local transmission phase of the epidemic.
And Cuba announced it has entered the stage of limited local transmission of COVID-19 on April 7th, leading to the adoption of further measures to stop the spread of the virus. Among the measures announced this Thursday are the total suspension of urban, intermunicipal and rural transport services from this Saturday. Transport will only be provided for essential workers. Health authorities are working on 4 clinical trials conducted in hospitals using the available treatments, including 6 team and 8 basic research projects. The key objective is to forge ahead to ensure the best treatment practices. It was also reported that the number of new cases is expected to continue to rise through April due to the number of contacts that infected people may have had. Another challenge that was highlighted was the existence of asymptomatic people who can spread the virus to others. The Public Prosecutor's Office of Ecuador has opened an investigation into allegations that personnel at hospital morgues are demanding payment from relatives in exchange for the bodies of those killed by COVID-19 in the city of Guayaquil. The city is the epicenter of the coronavirus outbreak in Ecuador and has seen dramatic scenes as residents are faced with a lack of both morgue space and funeral services to bury or cremate their loved ones. Ecuador has officially reported over 4,400 confirmed coronavirus cases and 242 deaths, but the real figures are thought to be much higher. Medical professionals are exposed to risk due to a lack of adequate protection. According to the most recent report by the Guayas College of Nurses, 7 nurses have been killed by the COVID-19 disease, while almost 150 others have tested positive. And our correspondent in Ecuador, Denise Herrera, brings us more details on the situation there.
The Ecuadorian authorities have informed that Ecuador has 4,965 cases of this new coronavirus and 275 deaths. The government also announced new preventive measures to stop with the spread of this new COVID-19. They said that they will evaluate the restrictions of mobility in each province of the country. In this context are still the citizens from Guayaquil denouncing that they didn't receive any government help, and now the citizens from Montesinain are against the project of the new cemetery announced by the mayor of Guayaquil, Cynthia Viteri. In this context, the citizens are denouncing that this project will affect them, will affect their territories, and they are still announcing that they didn't receive any help any water or any food. They are asking to the authority to help them and to respect the territory. Also, the medical sector in Ecuador is affected by this new coronavirus. We should remember that doctors and nurses were denounced that they didn't receive any government help, that they didn't receive any medical support to face this sanitary crisis in the country. Meanwhile, the government said that they are receiving help from different sectors, from different countries, and for different international organizations. So they are taking all the actions and taking all the preventing measures to protect the citizens and the professionals.
Venezuelan Foreign Minister Jorge Arias criticized the United States' persistent threats against the country, even in the midst of the COVID-19 pandemic. Through his Twitter account, Arias stressed that it is incredible that in the midst of a pandemic, the United States not only refuses to lift the sanctions, but also threatens and persecutes ships carrying fuel and supplies to Venezuela. Peruvian President Martin Vizcarra announced on Wednesday that the state of emergency will be extended until April 26, having analysed various reports submitted by the Ministry of Health and his professional team of advisors. Peru has reported 4,342 cases and 121 fatalities.
Becomes imperative to extend the state of emergency for 2 more weeks. The state of emergency that culminated on Sunday, April 12, extends until Sunday, April 26.
Likewise, Argentinian President Alberto Fernandez indicated that the nationwide lockdown will be extended beyond April 12th. However, Fernandez did not provide a specific date for the end of the quarantine measures. He made the remarks in an interview with a local television channel, stressing that thanks to the mandatory isolation in force since March 19th, Argentina had managed to slow the spread of the coronavirus. The country has reported 1,795 cases and 65 deaths.
This building was originally built for a school, but the urgency has turned it into this place where we are going to be able to attend to those who get sick with the coronavirus in a mild way. I am very impressed because they have worked a lot. They have put everything the necessary furniture, beds, oxygen, everything is done very neatly and with great dedication from the people who work here.
More stories coming up after this very short break, so don't go away. Welcome back to From the South. New York State, the epicenter of the coronavirus outbreak in the United States, saw another record number of COVID-19 deaths in a single day on Wednesday. Veteran doctors and nurses have voiced astonishment at the rate at which patients are deteriorating and dying. The novel coronavirus has officially reached more than 2/3 of the nation's rural counties, with 1 in 10 reporting at least 1 death. Nationwide, there are over 454,000 confirmed cases of COVID-19 in the United States, while over 16,000 people have died. For the second day straight, the virus killed at least 1,900 people in a 24-hour period. More than 6.6 million people lost their jobs last week in the United States as the coronavirus pandemic brought the economy to a standstill. According to the US Labor Department, 16 million jobs have disappeared in the last 3 weeks. In Florida, hundreds of unemployed people wait in line, hoping to fill out unemployment assistance forms after the website to complete the process online crashed due to the huge increase in new applications. The unemployed expressed despair in the midst of the lockdown and social distancing measures. The US Federal Reserve warned of an increase in the unemployment rate of up to 30% in the worst-case scenario. US economic activity is predominantly driven by consumerism, which has been heavily impacted by the outbreak. Spanish Prime Minister Pedro Sánchez defended his decision to extend the country's state of emergency on Thursday, stressing that the current lockdown was proving effective. Over 15,000 people have been killed by COVID-19 in Spain.
After these weeks, when the battle has been agonizing, we are seeing that the fire that started the pandemic is starting to stay under control. The data we prudently use are positive. We have reached and gone past the peak of contagion from COVID-19. We find ourselves near the beginning of the downward slope, what is called the de-escalated.
Nearly a month after a nationwide lockdown was implemented in Italy, debates are ongoing on whether to lift the measures. As the country with the biggest COVID-19 death toll in the world, at over 17,000, Italy's next moves will be closely watched. The authorities have been reviewing the lockdown measures every 2 weeks. In the meantime, a hospital in the northern Lombardy region has introduced robots to help nurses caring for coronavirus patients. Nurses wheel them to the patient's room, and once near the bed, doctors can use them to remotely monitor their condition, while patients can use the robot's touchscreen to directly communicate with their carers. The United Kingdom is entering what scientists say is the deadliest phase of the outbreak, with deaths expected to continue to rise over the Easter weekend. The latest figures show that the total number of COVID-19 deaths in hospitals has reached over 7,000, while the number of infections tops 60,000. Meanwhile, the Home Office announced the introduction of a new process to speed up incoming shipments of medical supplies. Prime Minister Boris Johnson has been moved out of intensive care and back to a general ward at St Thomas's Hospital in London. The UK government response to the pandemic has been heavily criticised, and frontline workers continue to be exposed to risk due to a lack of personal protective equipment. Russia reported a record single-day increase in novel coronavirus cases on Thursday. Almost 1,500 new cases were confirmed, taking the total to over 10,000. According to the Coronavirus Crisis Response Centre, the number of COVID-19 deaths rose to 76, while 1 million tests have been conducted so far. In a televised address, President Vladimir Putin announced that he was ordering an extension of the nationwide paid holiday, a measure designed to increase social isolation until the end of the month. In the Russian capital, Moscow, residents are only allowed to go out to buy food or medicine at a nearby store, or seek urgent medical help, walk their dogs, or take out the trash. Japan reached 5,000 coronavirus cases on Thursday, with the rate showing no signs of slowing despite a state of emergency imposed this week in Tokyo and 6 other areas. According to health authorities, the total number of cases does not include a further 715 on board a cruise ship that docked in early February in the port of Yokohama. The state of emergency gives local governors stronger legal authority to urge people to stay home and businesses to close. In contrast to stringent lockdowns in other countries, with fines and arrests for non-compliance, enforcement in Japan will rely on respect for authority and social discipline. Volunteers at the International Islamic University in Malaysia are sewing protective suits for medical workers. Malaysia reported the second lowest daily increase in COVID-19 cases on Thursday at 109 since a partial lockdown was imposed on March 18th. Over 63,000 tests have been conducted in the country and over 4,200 cases have been confirmed so far. Research by the World Health Organization and the Malaysian Institute of Economic Research indicates that the country will hit the peak of the epidemic in a week or two. China has reported 0 local coronavirus infections in the past 24 hours for the first time since the epidemic began. The news represents a milestone in China's costly battle against the virus. While the number of new cases has steadily declined since China imposed strict travel restrictions, authorities have called for continued vigilance amid fears of a resurgence of infections as the economy comes back to life and more people begin to move around. China took new measures on Wednesday to try to prevent asymptomatic silent carriers of the new coronavirus from causing a second wave of infections. The Beijing government announced on Thursday new guidance for bars in the capital, ordering that tables be set at least 1 meter apart, while stressing the importance of vigorous disinfection efforts. A temporary hospital is being set up in an office building in the northeastern Chinese city of Shufein, located along the border with Russia. The decision came amid mounting pressure due to coronavirus cases imported from across the border. The health facility will provide more than 600 beds with around 400 medical staff. According to Chinese health authorities, 40 cases of people returning from Russia were confirmed on Wednesday in the border province. And we're taking one last break now, but stay with us for more. Welcome back to From the South. African leaders have rallied behind the World Health Organization and its Director General, Ethiopia's Tedros Adhanom Ghebreyesus, following an attack on the agency by US President Donald Trump. Chairperson of the African Union Commission, Moussa Faki Mahamat, tweeted expressing his support and noting that the focus should remain on collectively fighting COVID-19 as a united global community. His post set off a chain reaction among a number of African leaders, including the presidents of Ethiopia, Rwanda, Namibia and Nigeria. South African President Cyril Ramaphosa, who is chairperson of the African Union, also weighed in, reiterating the call for global cooperation and solidarity as the most potent weapon against COVID-19 and its devastating health, social and economic impacts. Many displaced people in Burkina Faso who escaped attacks by extremists are now worried they're at risk from COVID-19. Violent attacks in the West African nation are creating one of the fastest growing refugee crises in the world. More than 800,000 people have been internally displaced, many of whom are living in makeshift camps across the country. There's concern that if the virus begins to spread among an already vulnerable population, it could have disastrous consequences. Burkina Faso has reported 443 coronavirus cases and 24 fatalities.
My biggest fear concerns now is to have cases being reported among IDPs or refugees populations, and that will actually take us to a very long fight with this outbreak. It will go beyond expected epidemiological forecasts.
The number of coronavirus cases continues to rise in South Africa, the worst hit nation on the African continent. 5 more people have succumbed to COVID-19, bringing the death toll to 18. Meanwhile, the total number of cases is 1,845. South Africa is currently in its second week of a 21-day nationwide lockdown in which non-essential workers are required to stay at home to curb the spread of the virus. According to the Health Ministry, the country has tested 63,776 people in the past 2 weeks. Kenya's courts have been closed for nearly a month due to the coronavirus outbreak. The country has imposed restrictions on movement and a curfew. With most courtrooms empty, judges and lawyers are self-isolating and only hearing urgent cases online. Some lawyers are calling this a dereliction of justice, while human rights activists are concerned that rights and the rule of law have been suspended in the midst of COVID-19.
It is often said that justice delayed is justice denied. The human rights and justice will not wait for the pandemic to come to an end, nor will the women who are raped and abused over this period, nor will the people who are in mandatory quarantine be able to wait. And lastly, those who have faced police brutality will not be able to wait for the pandemic to run its course. It could take 4 months for this to happen. So the judiciary has to find ways of ensuring that justice can continue to be dispensed over this period.
The Italian song Bella Ciao was adopted as an anthem of the anti-fascist resistance against the forces of Nazi Germany and Italian dictator Benito Mussolini. Today, versions of Bella Ciao are sung worldwide as an anti-fascist hymn of freedom and resistance. And we finish this news brief with a video of the Serbian National Theatre Orchestra performing Bella Ciao in the midst of social isolation in solidarity with Italy, one of the worst hit countries by the coronavirus pandemic in the world. Remember, you can get all our stories on our website, telesurenglish.net, and on social media. For Telesur English, I'm Katrina Goss. Thank you for watching and enjoy the music.